Okay. We are. Make sure you guys can hear.
Kathy, do you know how many people we have on the telephone?
Let's look and see here. Gallery view. Quite a few.
Okay, I see. Oh, yeah, we have a lot of people going.
We got some call-ins as well.
Good.
So let's see. We want to see the doctor. Where are you? We want to see you.
You want me to? Okay.
There you are.
Well, during the presentation, I'll be putting up slides, so you may not see me, but you can, I think you can right click on the video and say pin video. That way. Kathy, when I start, Kathy, do you hear me? Kathy?
She's there.
Kathy, do you hear me? Okay.
Yes,
Yes.
we
Okay. I mean, is it good sound going?
Yes.
Okay. All right, great. When I start, I'm going to mute all, and if you need to talk to me, just unmute yourself, okay?
Dr. Khan, you're muted. We're not hearing you.
Okay, do you hear me now? Okay. Yeah, I mean, I muted everybody, so you hear me, Kathy? You just, okay,
We're
great.
okay now.
Okay, wonderful. All right. Well, I'll go ahead and start. Good afternoon, everyone. I am Dr. Obayadir Khan. Some of you know me, some of you don't. But thank you for coming here today for this presentation on COVID-19 vaccine. Just to give you some idea how the presentation will go, at the beginning, I am going to mute everyone's microphone so that we don't get any background noise, but you are able to unmute yourself. So there is a button on the left lower corner on your screen, probably you can see, and you just click on it and it will unmute, it will allow you to unmute. So during the question answer session, if you need to talk to me and ask a question, you just have to unmute yourself and ask your question. Right now, I have muted everyone else except me so that we don't get any background noise. And during the presentation, I would request that you keep yourself muted. So I'll go ahead and start. So our topic today is COVID-19 vaccine. As you know, this is the topic of the year. We have been going through this pandemic, and we are all suffer from it. So, so I've decided to give you this vaccine update because this is the most important topic right now and most important issue at this time of the year. For your information, I'm just letting you know that I am recording this video and presentation. So if you have any objections, you can let me know. As of today, you probably already know this, 353,730 people deaths in the United States. 20.8 million plus people have been suffered from coronavirus. So in this presentation, what I'm going to try to give you an introduction, followed by give you basic information about how COVID virus infect us, basically, so that you understand where to hit when the vaccine hits, how it will hit the virus, and what would be the real approach to intervention. So if you understand the mechanism, then it will be easier to understand the vaccine technology. We'll compare and contrast the published data about two available vaccines that we have right now. And at the end, we'll know who should get the vaccine and who should not. And we also discuss how the vaccine is being distributed, and we'll give you an update what is going on about vaccination process at the Marbella and Cove. We have Jackie and Troy present here today, and I'm sure they'll give you some updates on it. So as you probably already know, the vaccines are the least expensive but the most effective means of interventions in any disease. You know about the smallpox. In the 20th century, smallpox claimed about 375 million lives. The first vaccine that was used was in 1796, used by a gentleman named Edward Jenner, who used smallpox vaccine first time ever. And since 1978, not a single life was lost because the smallpox vaccine was so effective. Since then, many other vaccines, 70 plus vaccines have been marketed, and many of them are very effective. As you know, polio has been eradicated, and we rarely see any cases like measles, mumps, or rubella. These are due to the vaccine was so effective. While there are many successes, but challenges remain. Effective vaccine could not be developed for HIV, malaria, or TB. these diseases claim about 4 million lives every year worldwide. So we need to know what is the vaccine technology. And we will discuss about this a little bit later. Like there are two types of approach in vaccine technology. One is like classic, which is the old approach, like the flu vaccine you know about, that where they inject the flu virus into an egg and incubate and then grow the virus and then generate antigen, and that's how they produce the vaccine and inject to people. The new technologies involve genetic vaccine and viral vector vaccine. We'll talk about it a little later. Before that, I needed to know a little bit about how coronavirus infect a person. So here, this is a structure of a coronavirus. As you can see, the virus has a small structure inside. It's called RNA, because the coronavirus is an RNA vaccine. So it doesn't have anything else. Basically, it has this RNA, and it has an envelope. And on the envelope, you will see some proteins spiking up. These are called spike protein. So this is an electronic microscopic appearance of a coronavirus. And you can see that the virus is enveloped, and then you can see these spikes. These are called spike protein. This spike protein is used actually to attach to our cells. The virus attaches itself with these spikes to our cells, and that is the initiation of the infection. So to understand that further, I'm just giving you a structure of the cell here. So once we inhale the virus, specifically via our nose, it goes into our respiratory mucosa. And then there are specific enzymes on the cell surface of our lungs, where specific enzyme is called ACE, angiotensin converting enzymes. Virus is really, and this virus really likes that, actually, to tell you that in simple language, virus likes that because that enzyme is needed for its entry into the cell. So this is a cell, one of our cell in the body. Virus goes in, and virus has this spike protein, and this spike protein likes that angiotensin converting enzymes of our respiratory cells and attaches that to that cell wall and slowly get in. So you can see this spike protein is very important for the virus to attach to our cell. So as it goes inside the cell, and it uses our body's cells or structures and inside these organelles to reproduce more and more viruses. So it basically uses our cells and just reproduces itself using our machineries. So it's like, virus is like a thief. So it just comes in stealth mode and just goes in and reproduces itself inside our cells using our own cell structure. See, virus is very simple. It just has a low RNA. There's nothing else. It cannot reproduce itself. So that's why when it is outside, it falls on the air or somewhere, it dies. To reproduce itself, it needs our cells. So that's how it goes. So as you can see, this spike protein, which through which the virus attaches itself to our cells, is very important for the virus. And that's where the researchers found interest and produced this vaccine. And this will be the basis of production of the vaccine, this spike protein. So it makes sense, like if we can develop antibody against this spike protein, the virus won't be able to attach to our cells and won't be able to infect us. So that is why this slide is very important to know. This is an electronic microscopic appearance of the cells infected the virus. So these are tiny little viruses all over this cell structure, and you can see they're like slowly going in and infecting the cell. Many of you go to internet, and there are a lot of time good videos on how the vaccines are being developed. And one such video, I like it because I've seen this video. It is produced by JAMA Network, like Journal of American Medical Association Network, JAMA Network. And their video is very, very nice. If you have the opportunity to go the YouTube and type in JAMA video on COVID vaccine, and it gives you real good picture on how the virus vaccine has been produced. I'll just click you. I'll probably, let me see whether it comes on. I am not sure. Okay, let's see. No, it doesn't, it will not. So anyway, so I'll just move forward with this. Okay, so as we talked before, there are two approaches in making the vaccine. One is classic approach, that is like using the eggs, like you have known for the flu vaccine, like you inject viruses into the eggs and reproduce them and produce their antigen that way. The other way is the genetic vaccine, which is the newest technology that have been used in this COVID vaccine. And in genetic vaccine, what is it? Basically, these are called mRNA vaccine. The reason why they are called mRNA, stands for messenger RNA, ribonucleic acid. The virus has that RNA. This is a messenger RNA. So what the scientists did, basically, they took a virus, they took the RNA material of the virus, and then you see this virus has, RNA has specific areas where this RNA encodes this spike protein, meaning like this area of the RNA tells the cell to produce this spike protein. It's like a program inside the virus. So what the scientists did, they took the virus, they took this RNA, and they cut out this small area of the virus where the coding for the spike protein is written. And the scientists modified that portion of the RNA and told the RNA, saying that, well, you make some protein which would be like spike protein, but that will not harm us. So they're like, they stole this little portion of the RNA material and changed their coding system and told this RNA, well, you make this spike protein into our cell, but that but but produce some spike protein that will be harmless. So that is the basis for this new vaccines. Um, so that is what they did. They took this little RNA material and then they enveloped them with lipid nanoparticles, because this RNA is very unstable. I mean, they don't really last long when they're like out of the in their environment. So that's why they also cover and envelop them with lipid nanoparticles. And then when this lipid nanoparticle envelope modified RNA is injected into our cells, this RNA came down into our cell and told our cells, our own body cells, that you produce some virus, actually spike protein that will be harmless. So that's what, this is our cells. This is like our own body cells. This is the modified RNA that is injected into a body, and then the RNA told our uh, cells to produce this harmless protein, which are similar to spike protein that the virus has. So what happens? So our body is producing, once somebody gets vaccinated, the body produces this kind of spike protein. These are harmless, but our body thinks, oh, it looks like the virus spike protein. Okay, it is not familiar to me. I'm going to resist it. I'm going to produce antibody against it. And that is the basis of this vaccine. I hope I was able to make you understand, but so this is the basis of these vaccines. So once they have developed this in the laboratory, they did trial run in animals first, and they thought, okay, animal did good. Then they go through the human trials, as you know, phase 1, phase 2, phase 3. Phase 1 means like they initially tried a small amount of people, like about 35 or 40 people. They injected the materials into them and saw if they're reacting. If they didn't see much of reaction, then so it is safe to go ahead and do the safety and immunogenicity trial, meaning like, they will see whether this is really effective. So first they did a safety trial, then they move into the effectiveness, and that's what they did in these two vaccines. I'm going to show you a little bit later about their differences, what they have found. So currently we have two vaccines, one from the Pfizer and BioNTech. These two companies together made one vaccine, and the other vaccine was produced by Moderna, but this was developed by the National Institute of Allergy and Infectious Disease. The scientists there, they developed it, but then they gave it to the Moderna. So you probably saw these pictures in the newspaper and TV that these are the these are the developer of actually the owner of the BioNTech, and how and you probably saw a lot of news about them. These are Turkish gentlemen who actually established this BioNTech company, and now he became famous by developing this vaccine. So the first publication we learned about from Pfizer and BioNTech vaccine, it was published in the New England Journal of Medicine around beginning of December, prior to the approval. As you know, the first vaccine was approved around December 7th or so, around that period of time. So what was presented in this New England Journal article, I'll just go through quickly so that you understand what was found. So this study showed that actually this is the safety and efficacy trial. This was the code name of the vaccine when they were doing the trial. It was a randomized, meaning double-blind study of mRNA, messenger RNA vaccine. I'll just go to the next slide and tell you what they have found. Okay, so here in this is I'm talking about the Pfizer and BioNTech vaccine right now. So in their trial, they took 44,820 participants. And then, as they take the participant, they have certain criteria. So some people did not qualify, others did not qualify, others did qualify. So ultimately, they came down to this number. So on the placebo group, they had 18,530 who received the vaccine. Actually, the placebo group who received the saline solution, they had 18,530. And on the vaccine group, they have 18,556 people. So the two groups received the vaccine, and this is a 2-dose vaccine, 21 days apart. So they gave 1 dose followed by another dose in 21 days. And they followed these people. And there are a lot of things happened. They reported that, in the trial group, the people who received the vaccine, they have 48 people discontinued the trial after the dose 2, so 27 withdrew it, 18 people were lost to follow-up, 1 died, but that was not related to the COVID. One was withdrawn by the physician, 1 had medication error, so events happen. So they are just reporting those. So this is the data of the demographics data of the people who were involved in this trial. There were like men, women, 51% versus 48%. By the way, this is the column for the vaccine group. This is the column for the placebo group who received only a saline solution. You can see like whites were represented almost 83%, and then blacks were like 9.2%, and so on. Okay, Hispanic and Latino had a big group, 27.9%. And this trial went on into multiple countries. Argentina, Brazil, South Africa, and United States. We had the largest number, 14,000 in each group. So 28,000 in the United States. Is of particular importance is that how many people are more than 55 years old. It has like almost 42% people had more than 55 years old. So these are like basic demographic data. So what they have found is that, so this is important to know that they also reported that what has happened, like after giving the vaccine, how many people have gotten side effects. So they say that local events, mean like pain and swelling at the site of the injection, were pretty much similar, or you say maybe a little bit more for the vaccine group. So you can see local events like pain and swelling happen more on the vaccine group here. Placebo group did not really have that much of problems with that. And this is the data for more than 55 years old, which we should be, we are more interested in because of the demographics we deal with. So more than 55 years old, after dose 1, you have more pain and swelling compared to placebo, same as expected. But other thing happens, as you can notice, that some people did complain of fever, not many, maybe 10%. In the vaccine group, placebo group did not have any fever, 0. Fatigue, another side effects happen, fatigue. On the vaccine group, you see 51% did complain some kind of fatigue. And placebo group also did have some fatigue. I'm not sure where that came from. And then headache. As you can see, some people did complain of headache. Almost 40% people had some headache. Placebo group has only 14%. So on, chills happen a little bit. Vomiting did not happen much. Diarrhea did not happen much. Muscle ache, about 29% people had muscle ache. Joint pain happened, more on the vaccine group. Not much, about 19%. In the vaccine group, 38% people did use some kind of fever medications. So that's what they reported. So ultimately what they have found is this. This is very important to know, the vaccine efficacy, that's what we are interested in. So after the vaccine was done, like 2 doses were done, after about 7 days, what happened? They found out, like in the vaccine group, only, I'm gonna show you this only so that no confusion. In the vaccine group, only 9 people got COVID after they finished 2 doses of vaccine. On the placebo group, they had 169 people who suffered from COVID. So you can see people who received the vaccine did not have that many of COVID cases. They still got some, but not many, and they were mild cases. On the placebo group, 169 cases of COVID. So that gave them the data of saying that it is almost 95% effective. So that's where the term came out that, oh, this vaccine was 95% effective. I want you to draw your attention to this slide here. This is efficacy of the vaccine in different age group. So I will show you efficacy of the vaccine in people who are more than 75 years old. You can see I put an arrow there so that you know that people who were more than 75 in the vaccine group, there were like 774 people who received both doses of the vaccine. And look at the cases, number of cases were 0. They didn't have any cases. So it is more effective in the 75 years older and older people. So that is good. On the placebo group, there were like 5 cases. So so that is very effective. So vaccine efficacy in the more than 75 years and older was almost 100%. The effectiveness was 100%. So that is a good data. But remember, this is only 2 months worth of data because they followed these people for only 2 months before this one got approved. So there was not enough time to say, well, this is completely true. But going forward, we'll know. This is the just graph. As you can see, this is the vaccine group. This is the vaccine group. This is the number of cases. This is the vaccine group, and the number of cases did not go higher. On the other hand, the placebo group, as you can see, as time goes on, there are more and more cases happened. So placebo group had more higher number of cases, as I mentioned in the previous slide. So now let's talk about the Moderna vaccine. I was talking about the Pfizer vaccine. Let's talk about the Moderna vaccine, and it was developed by the scientists at the National Institute of Aging, Allergy and Infectious Disease, where Dr. Fauci works. I mean, he is the head of that. So they produced this vaccine there and worked with Moderna to produce the vaccine. By the way, I just wanted to give you some timeline. Remember, in the COVID cases started in China, who knows, maybe somewhere in September, October, or they didn't tell us, I don't know. But by January, the National Institute of Allergy and Infectious Disease knew about the coding sequence of the RNA, because they asked the Chinese to give them the coding sequence and put it in a database. So they did. And they didn't have to identify the virus, but they looked at the coding sequence from the database, and that's how they started working right then at the in January. And the Operation Warp Speed was really speedy, because it was never heard of that there was a vaccine could be developed within a year, and started to give to the people. So this was amazing. Normally it takes about sometimes 15 years to develop a vaccine. Here we have a vaccine within a year. That is amazing. So this was their data. This Moderna data was not initially published until like December 30th this year, like just before the New Year's Day. We got this data published in the New England Journal of Medicine, but the vaccine was already approved by the FDA under emergency use authorization on December 17, based on the data. So based on the unpublished data. So this is again a randomized double-blind trial that was done. And in this trial, the Moderna trial, they had 30,000 people, and this was done in the United States. And 15,000 assigned to the vaccine group, 15,000 to the placebo group. They ultimately came down after exclusion, loss of contact and everything. They have 14,134 patients on the vaccine group, 14,000 on the placebo group. So what they have found is this. Actually, let me just go over the demographics of these people. So let's see if I can make it a little bit more. Okay, here it is. So similarly here, we are more concerned about the people more than 55 or 65. In this study, they had about more than almost 25% people are more than 65 years old. And they have equally, compared to the other studies, they also have almost similar white, almost 79% people, blacks were like represented about 10%, Asian 4.8%, like, and so on. And these are some, there are some other risk factors they have included because, okay. So in this slide, they told us about what side effects they have noticed in these people. So this is the local events, meaning like redness, swelling, or pain at the site of injection. So this is local events, placebo, dose 1, placebo. These are the placebo group. Not many people complained of pain, about 20%. But on the vaccine group, This is after dose 1, this is after dose 2. Both groups complained of a lot of, both groups complained of pain and swelling. This is expected. This is not unexpected. We all get pain and swelling after any vaccine. So this is not unexpected. This is about pain. So these two lines are for placebo group. These two lines are vaccine group after dose 1, after dose 2. Pain. So they did complain of pain. Swell, and then this is the data about some redness. So there are some people did complain of some redness after the second dose. Swelling, some people did complain of swelling, and some people did have some lymph nodes, gland enlargement on the side of the injection. So about maybe 10%, 10-12% people have some lymph gland enlargement. So after, this could be expected. Now, other reactions, that is like generalized systemic reaction, what happened, fever. It looks like after the second dose of the Moderna vaccine, there are quite a bit of fever, maybe about 15-20%, 15% people did complain of some fever. Headache. Looks like after the second dose, there are quite a bit of people who did complain of headache. That will be like about 50-60%. People did have headache. Fatigue. People after the second dose, the first dose, there were a few people did complain of fatigue. But look at it, is interesting that placebo group were also complaining of fatigue. Placebo group here. So, so fatigue seems to be, there could be a placebo effect too. But here after the second dose, they did complain of more fatigue. Myalgia, meaning like muscle pain. After the second dose, you see more than 50% people. Pain in the joint, arthralgia, pain in the joint. Yeah, they did have pain in the joint. Some nausea and vomiting after the second dose. Chills. Some people did complain of chills after the second dose. So it looks like in the Moderna vaccine, people did have more slight, I would not say reaction. This is not reactions. This is side effects. Any vaccine can give you side effects. And that is not a reaction. And this is expected because your body is generating this antibody and your body will show some symptoms. So that is what happened in this. So here is the case. So in the vaccine group, these are the number of cases, not many cases. I'll show you the numbers later, but you can see in the placebo group, number of cases went higher and higher and higher, like the other vaccine. So similarly, same. So let me draw your attention to this. We are concerned about more than 65 years old, and you can see that in the placebo group, they have 29 cases out of 3,500 or so people. On the side of the vaccine group, they have only 4 cases. So the vaccine was quite effective, very effective. So here is the, I put this as a comparison for both vaccine. Here's in summary. So in the Pfizer, this column is the Pfizer column, this column is the Moderna column, and total study population on the Pfizer was like about 43,000, and we know that after all the exclusion, they came down to about 37,000. Moderna group, 30,000. Effectiveness, Pfizer vaccine was 95% effective. And Moderna vaccine was 94.1% effective. And both vaccines are 2 doses. For Pfizer vaccine is 2 doses 21 days apart. For Moderna vaccine is 28 days apart. And we have already shown you the side effects of the vaccine, like pain, fatigue, headache, fever, chills, vomiting, diarrhea, muscle ache, joint pain can happen in both of these vaccines. On the Moderna group, they have reported some lymph gland swelling. And these symptoms usually last 1 to 2 days and goes away after that. And the population that were tested in the Pfizer group was more than 16 years old. And in the Moderna group, they were like more than 18 years old. So that's how they came out, the idea that the vaccine should be given more than 16 years old, or Moderna vaccine should be given more than 18 years old, because below that they didn't know, because the people were not included in the study. So we don't know how they will react. Also, same thing for the pregnant. Pregnant women were not included in the study, so we don't know how they will react to the vaccine. So storage in the Pfizer vaccine must be stored at -70 degrees Celsius. On the other hand, the Moderna vaccine can be stored in the regular refrigerator at 2 to 8 degrees Celsius. And as I said, who gets it? Age 16 and above for the Pfizer, and the Moderna vaccine can be given age 18 and above. Who should not get it? Anyone with history of vaccine allergy or anaphylactic reaction, meaning like severe reaction to anything, actually. Same way the Moderna vaccine also, since they have rolled out the vaccine in the general population, there has been several severe allergic reaction happened. That's about maybe 1 in 100,000 cases or so. Not many, but these people had history of severe allergy or anaphylaxis in the past. So that's how they're saying that if somebody has severe allergy or anaphylactic reactions in the past, they should not get this vaccine. And there has been no recommendation about children and pregnant women because these people were not included in the study. Some people I have seen that they are recommending pregnant women to get it because this looks like this is a safe vaccine. So, so there may be questions about, if somebody had suffered from a COVID infection, recently recovered COVID, should they get it? There has been no consensus about it, but many specialists or scientists, they're saying that maybe they should wait 60 to 90 days after they suffer from COVID. Others say, well, they could just get it. But if somebody got an antibody treatment, they should probably wait 90 days. I have seen an interview of Dr. Fauci where he was asked whether President Trump should be getting the vaccine, and he said to wait 90 days after his treatment with the antibody, because he received antibody treatment, so he should wait 90 days before he gets the vaccine. So another question comes, okay, should I go out and do wild behavior? So if I get the vaccine, can I still carry the virus? Yes, you can. You could carry the virus, but it probably can't infect you, but you can still transmit it. So that's why even if you get the virus, make sure you follow the safety precautions like before and don't do any wild behaviors. This is important. And then comes to the distribution of the vaccine. And as you know, there are massive production of the vaccine going on, and they have been transported to different parts of the country. CDC has given recommendation. There are like phase 1A, phase 1B, and phase 1C. For phase 1A, CDC recommends that healthcare personnel and long-term care facility residents get the vaccine first, phase 1A. Phase 1B is for frontline essential workers and people age 75 and older. And phase 1C is for people age 65 through 74 years and people age 16 through 64 years with underlying medical conditions and other essential workers. So that will be phase 1C. Here in Florida, our Governor DeSantis has put out an executive order saying that the long-term care facility residents and staff should get the vaccine first. Then comes the person 65 years old and older. Next, healthcare personnel with direct patient contact. Next, persons deemed to be extremely vulnerable to COVID-19 by hospital providers. So this is the directives came from Governor DeSantis. In Collier County, there have been several vaccination clinics for skilled nursing facilities and a few assisted living facilities. In the community, Collier County Health Department, I believe it was on December 30th, they put out a press release which came out about 9 o'clock in the morning. I did send out an email about 10 or 10:15. By 10:30, they were all filled. The slots were all filled in 1.5 hours. So since then, they have put out several dates. All are now filled. So far, I know during the weekend, one of my patients, I told my patients to call me if they can go and sign in. So somebody called me during the weekend, said that they were able to sign in for one. And then right away, I went to the website. I was not able to sign up for the vaccine. So, so this is going on at the state level and county level. Walgreens and CVS are also authorized to give the vaccines. In the skilled nursing facilities and assisted living, I believe it's the Walgreens who is giving the vaccine there. Collier County Health Department, I know they're going to get more vaccine and slowly roll out more and more vaccine for the community here. So I know this is a slow process, but I guess as they get more vaccine and more vaccine,
Hi, Peter.
we'll be able to direct people to get vaccinated. So this, I believe this is my last slide. I will open up for question answers, but before that, I would like to ask Jackie or Troy. If Jackie here, I would like to ask her to give an update about the vaccine status at the Cove and Marbella and what will go on in the, what to expect. Is Jackie here?
Yes. Hi, Dr. Khan.
Thank you.
We have been scheduled for a vaccine clinic on January 14th here at the Cove. It will be for the healthcare part only. I have tried and reached out multiple times to different people to try to get the Marbella as well. They are saying that their directive is for the healthcare facilities at this time. So that doesn't mean I'm going to give up. I'm going to keep trying to get the Marbella vaccination clinic. If I can, I'm going to try to get it on site or at least try to get an idea of where they can get it.
Thank you, Jackie. I understand.
Well, I'm sorry, we'll be receiving the Pfizer vaccine.
That's wonderful. Very
Yeah,
good. I like Pfizer vaccine.
Yeah, so I called today and she said, yes, it would be the Pfizer vaccine we'd be receiving.
All right. That's wonderful. I know if Marvella would have gotten, that would be nice. But the way it looks like from the governor DeSantis's executive order, they're focusing on the facility that is like skilled nursing facilities or assisted living facilities first. And that's why probably the tower was not included. Right, Jackie?
Yes, I think so. Every time I've called and I've been bugging them, so they kind of know me by name, that they keep telling me it's healthcare only. So I'm just really hoping that they open up and they start doing clinics. You know, it would be smart for them to do the clinics in a high rise. And so I'm going to try and suggest that if we can do something like that.
Yes, yes. Thank you, Jackie, for doing that.
Dr. Khan, Troy would like to speak to you.
Yes, okay. Troy.
Dr. Khan, thank you so much for your presentation today. I also wanted to let the community know that in looking at this last slide with the Collier County Department of Health, is that if any of the members do need assistance in order registering or at least placing their name on a waiting list, that Kathy, Michelle, and myself were available to help all the residents navigate the site in order to get themselves on a waiting list. And then from what we understand, that then Collier County Department of Health will then be notifying those that are on the list by email on the location and the date and time of when they can receive the vaccination.
Thank you, Troy. Yeah, we'll keep an eye. Whenever I see something open up, I'll certainly send out also email if I know right away, because it looks like the slots are gone. I mean, even before we send out the email. In any case, at this point, I would open up the question answer session. If you have any questions, you can unmute yourself and ask that questions directly. Kathy, do you have any questions from the audience up there? I know you don't have a microphone.
Yes, unfortunately, our speaker's not working, so we do not have a microphone.
Okay.
But I've asked people to write their questions down, and we can email them and get back to them. Or if somebody would like to come over here and ask a question, you're more than welcome to. Okay, we have a question here.
Hi, my name is Nancy Wyckoff. I have a question. What's happened to the 70? You're only going to 65 on these shots. What about the 70 and older, for which we have a lot of people?
Can you repeat the question?
I'm sorry, what? Repeat the question. Okay, what about the vaccine for the people that are over 65?
Okay, yeah, there are people included in the studies who are more than 65. So they did receive the vaccine.
I have to what? Repeat.
People more than 65 did receive the vaccine. You're talking about the studies, right? In the
I'm talking about getting the shots.
Or getting the shot, yes. So yes, see, the shots are being managed and coordinated by the state. So right now in the community, the Collier County Health Department rolled out the vaccine saying that people more than 65 can come and get the vaccine. The problem is they don't have enough vaccine.
Also, what about medications that you're taking? How will this affect you getting the shots?
To my knowledge, you don't have to stop any medications. There are no interactions with the shots and the medications.
All right,
We
thank
have
you.
other questions on the
What?
board.
Okay, I
Okay.
can't see my glasses.
That's okay. hon. We can email your questions, okay?
Thank you, because I think that's kind of important in a lot
You're
of.
very welcome. We'll email questions to the doctor. Okay. All right. Anybody else?
Yeah, I have one for Troy.
Okay, he's not here.
OB, Leroy Crosby here.
Hey, Mr. Crosby.
What are the advantages of taking zinc once or twice a day as a pill in regarding to your immunity or your resistance to the COVID vaccine?
Yes,
Zinc be a help?
yes, zinc is helpful. Some studies did show that taking zinc helps with the severity of the virus infection. People who are taking zinc has less severe virus infection.
Okay, thank you.
Yeah, so it is helpful.
Compiling a waiting list now.
Okay, Mr. Shapiro, go right ahead. Did you have a question, Mr. Shapiro?
How'd you do that?
When you go to the site and you go to the.
Hello?
You just put me on?
Kathy,
Yes,
Kathy, it's Marie Ablov. I have a question for Dr.
Get on
Khan.
the waiting
there
list.
you go. Go ahead.
Dr. Khan, do you know how many vaccine doses are being given to Collier County?
Thank you, Marie, for your question. Unfortunately, I have no idea because these are not communicated to anyone. So only the Collier County Health Department knows, or the people in Tallahassee knows. So I have no idea. I'm sorry.
So we don't know when the next vaccines will be given.
That's right. I have no idea because looks like they're giving this information through their website, and then it is picked up by the news media.
Can you go down on that website?
No,
So-
Thank you very much, Dr. Khan.
this is his
You're
slide.
welcome. Are there any other questions I can answer?
Well, anybody else have a question?
Yeah, Kathy, did Troy imply that the county health department is compiling a waiting list?
Yes, sir.
Yes, in fact, if you go to their website and click one of those, like this eventbrite.com appointments, and at the bottom of that page, you will see waiting list, something like that. I think so you click on there and put your name and emails. I did put my name and email to see how they respond. I haven't received an email back. So that's what I can say. I have tried that.
And like Troy said, we can help you with that. If you would like to call us, and we'll be happy to put you on that list.
Yeah, I tried, I didn't get in, I didn't manage.
It's really just a name and an email is what it is.
Mhm, mhm.
It's okay, we'll help you. Okay. Perfect.
So that's good, Kathy, if you could help them out that way. And be vigilant, like, if you can go to their website on a daily basis and see if it opens up, the sign up and let others know right away. So, but I expect that it will be easier as time goes on. They're getting more and more vaccines, and more people will be vaccinated. Demand will be less. So shouldn't be that long. So.
Do you have a question, Ms. Potter? No? Anyone else? Perfect. Thank you, doctor.
You were welcome. It was my pleasure. I hope to do these things more. And if as the information evolves, we will try to give you more updates on this and keep you up to date. If I know anything like opens up, I'll shoot out an email right away, to Kathy or Jackie and Troy, who can then disseminate that information. But we'll keep an eye on it. Well, my hope and prayer that everybody stays safe and we get the vaccine quickly, and we want to go back to our normal life. So that is our best hope. Yeah. So I think those days are not far away. I know you have been working hard, staying indoor, keeping safe, distance, and maintaining all the safety precautions. This is just helping all the community, not just yourself. It is helping the whole community. So let's just keep these things going for a few more days, and we'll go back to our normal life pretty soon. And I think they're talking about maybe by the fall of this year. So that's what they're expecting. So time will tell. All right. Thank you for attending. It was really a pleasure.
Thank you, Dr. Khan.
Thank you.
Thank you. Have a good day.
Have a great day.
Bye-bye.
Bye-bye.
Are we gonna get a copy of that paper? Which one, honey? No, we can send it to you. It's all